Started right on time, and welcome everyone to the Education Subcommittee for Senate Finance. Today we have one presentation, and that will be coming from Superintendent Lisa Coons. Superintendent Coons will be sharing updates relating to learning loss, the proposed upgrades to the student assessment system, and the status of student quality. So welcome, Superintendent Coons. We're happy to have you with us this afternoon.
Intervention, and we really wanted to provide technical assistance of what we've seen work across the country and what we really need to focus on. We also heard from them that they wanted some state-focused tools, so we looked at our own ESSER dollars and tried to figure out what we could do in addition. So we ran an accelerated RFP process for math tutoring support and literacy tutoring support. And as we went through the literacy tutoring support, we realized that our school divisions needed two different kinds of literacy support. That with Ignite, which really starts on the how to read components, and Lexia, which is more developing capacity. So to date, we have 3 programs that come alongside of our school divisions and really help support their needs. I just want to highlight how unique our school divisions are working through these dollars, which they all have appropriated. They're all receiving bi-monthly installments, which will end at the end of this year, but they can use all the way through 2026. So if I look at this board that I'm really proud of, Chesterfield really looked at what they were already doing, what they were already investing in, and then expanded their tutoring coaches and really dug into what they could expand and support. But then we looked at Portsmouth. Portsmouth had a large portion of kiddos, so they really targeted it to 80 classrooms and worked on focusing classrooms. Then when we looked at Page County is in a rural area. It's very different than Portsmouth or Newport News. Page County focused on during the day, but also knew they couldn't serve all their students during the day. So they thought about programs they could do before and after school, but knew that the programs before and after school would be barriers for their families given transportation needs. So they drove some of those dollars to an after school bus. And then when we look at Caroline County really had to think about staffing and had to think about how they supported staffing given where they were in their staffing models and what they needed. So they worked hard with their paraprofessionals in training those paraprofessionals to use things like Zern and Lexia and be successful in their tutoring model. And then I just have to shout out Newport News. My friend Michelle Mitchell is done everything and everything. She has before school tutoring, after school tutoring. I talked to her a little bit today. She's like, during the day, we need everybody and we need to think about weekend and summer. She actually on the weekends does a cohort model, and you might be going to this elementary school or this elementary school, but you have the same need. She brings them over to one elementary school with the best teachers and then adds in future teachers, which are high school students who want to be teachers, and partners them together to focus on those students and have small groups. So you can see how different each school division has thought about that plan and really been intentional. It has been our joy, and I just want to say Dr. Sorensen leads this work to go side by side with our school divisions and think about what they are doing, what they had, what they needed, what their challenges were, and really overcome those challenges to make sure we have success. So I just want to highlight very quickly, I'm a program girl, so I'm sorry, I'm going to do a little bit of program, I'm going to try to focus on funding. But we have 56,000 students enrolled in Zern today. 87% of our school divisions have opted in. 1,531 teachers are trained to support what they're doing in the classroom in Zern. but we have 316,000 hours already logged of tutoring support for our students. I'm really proud at how everyone has come together to focus those efforts, to make sure that those dollars are going where we need them to go, and to partner with our work and their work to bridge together to really help our students get caught up and a step ahead. And we will continue to work collaboratively. We are starting to get feedback loops and sessions. Dr. Sorensen works every day with our instructional supervisors to make sure that we're targeting and thinking intentionally about learning loss recovery. So very appreciative of what you focused on, very appreciative of what you've done, very excited that our school divisions are each doing this a little bit differently. And then in addition, they've dedicated dollars to literacy, which, as you guys know, some of you do not. That's my humble passion. That's where I come from. Very much love our literacy work. And so a lot of our literacy work, same 5 school divisions, have leaned into specialists. Not only the specialists that are required by the Virginia Literacy Act, but they've added more specialists and more training to really dig in and think about that. So a lot of the dollars of the flexible funding not only went to tutoring, but they've also gone to expand the specialists, expand the training, and make sure we're ready for next year when the Virginia Literacy Act comes into full alignment. As many of us know, it's a big shift for our teachers. We've taught reading for a long time differently, and we know how to teach reading now. We know what the science of reading says. We know what studying brains are to do, and we want to make sure our teachers are equipped with the best resources, the best training, and that side-by-side support that they get from reading specialists. So you can see that most of our school divisions are leaning into either training or literacy specialists with some of their flexible funds, and then thinking about PD on top of the Virginia Literacy Act PDs such as letters, or providing intervention and supplemental literacy resources. So excited to see where they're going, excited to see the work and supporting our school divisions. Happy to pause there on learning loss. I know there were some questions and asks before we dig into assessment. So if you would like, I can pause and talk through any questions you have on learning loss, or we can dig into assessment. So Madam Chairman, tell me what would be most helpful.
Any questions on learning loss?
Just really incredibly proud of the work.
Glad you shouted out Newport News.
Absolutely. Michelle Mitchell is one of my heroes. She is doing great things. Yep. And Page County, we were in Page County 2-3 weeks ago celebrating the nurse who helped one of her colleagues, and we had a whole assembly for her and talked to the children about everyday heroes. So it was really exciting being out in Page County as well. I could talk about all your school divisions, but I think you want me to move to assessment. So I am going to talk a little bit about the 585 work group on assessments. Last year, then Delegate Van Valkenburg passed legislation with the General Assembly to ask us to study where we were in assessments. We combined together to have the 585 work group and the 585 report that came out in October. That work group included teachers, it included testing specialists, instructional specialists, parents of special education students, the Virginia School Boards Association, and some superintendents, and 3 of our school board members all contributed and studied how assessments were working in Virginia and compared those assessments, whether it was high school math, 3rd grade reading. They really dug into assessments across the board and looked at what we were doing in Virginia in comparison to some nation-leading states and opportunities. And they came out with a report on October 23rd and really focused on 5 things, and you'll see that in the slide deck. First, we have to increase the rigor of our standards. And really, when they talk about the rigor of our standards, it's not making them harder. It's being clear about what we expect so that our assessments can actually measure what we're expecting in our standards. What they were finding is that our past standards were pretty vague, and they wanted clear standards that really helped assessment designers and teachers understand what was expected and what they would be seeing on those assessments. They also wanted us to go beyond simple multiple choice questions. In the assessment world today, you can do all kinds of performance tests, all kinds of very creative and innovative things in assessments, but right now Virginia's assessments are simple multiple choice assessments. That doesn't give really good information to teachers or parents. What we know in today's assessments is that you can really dig in and figure out how students learn and how students are learning and where they are in that mastery of that standard. And they gave us clear feedback that they wanted us to use better assessments, use more assessments that had writing, more assessments that have multiple parts so you could see where the students' learning was breaking down or where they were demonstrating. There was also a clear ask around reports. Our teachers and our parents don't feel like we're getting good information from those assessments, and they want to better understand, what is that assessment testing? How is my child doing? And how do I support them? So one of the clear action steps from the work group was that we had to have better reports. But within that reports, teachers want to see those test items, and teachers want to know what those test items look like. In Virginia, we have not been releasing test items because if you think about how a test is built, those items cost money. Each item has to be tested, has to be run through a process and run through a federally required process. If you release those items, you're releasing those items, you can't use them again. But that's important to our teachers to be able to see those items and understand how we're measuring them. So that adds some cost to the assessment design. It adds some cost to releasing those items. But that was a clear piece of feedback that they asked for. They also said it's really hard when you work with this piece of a test or mess with this piece of a test and you don't work on the whole set of tests together. It's hard for us to continue to adapt and move forward. And they want to make sure our system is coherent, not just our end of year tests, our growth, our Virginia growth assessments, our end of course, in between grade levels. They really want the system to work together better. And they know They know that other states have really innovative assessment items and really exciting things going on, and we study those. They want those in Virginia. So when we look at cost, and we look at the cost of assessments, releasing those items, releasing the items of tests, and then looking at the number of tests that happen in Virginia. Virginia has more assessments in code than almost any other state in the country. We also, when you look at Brookings' report, we also spend less than most other states. The highest average in states is around $27. Virginia spends $18 per student on an assessment. If we look at the PARC Consortium, which is several states across the country, they are charging $25 per student. So we have a very different investment right now, and that investment has been compounded over time because we haven't been able to do that innovation over time. So we're a bit behind in where we are in assessment and being able to produce those assessments that the 585 work group wants and where we need to go with assessment. So when we look at a few other states on the next slide and look at what they're investing, New Jersey in their very first year invested $22.8 million on their first state to develop those items, to develop that coherence, to think about that space. Tennessee in 2018 and 19, so 4 years ago, spent $37 million on their test development, which $9 million was just those items. This is a very expensive process of designing the test that we have. And Texas this year is spending $97 million a year for $388 million over 4 years to build their assessment items out. So this is a cost. We feel like the number of $25 million for federal year FY25 will allow us to do both that fiscally responsible test development of $10 million and then implement an assessment system that is more coherent, more innovative, and most importantly, has better reports for our families and teachers. So that gives you a little bit of in-depth into where that $25 million we have is about a $25 per student cost estimate for that. We do expect to be in a procurement process in the next month. We have spoken with DGS and other spaces about whether we would do an RFI or an RFP. Their recommendation is, and we have actually had this experience in the past year, when we just do an RFI, we have several companies promise to do things, and then when you get in the RFP place, they can't actually follow through. And they have recommended that we do, because this is such a large contract and such a time-consuming contract, to go ahead and do an RFP process, which allows us to get into that transition, have time to develop those items, and make sure we have a seamless transition from the current provider to whoever may win that RFP in the future. So happy to take questions on the assessment item in the budget and where we develop those items and why we are coming to you after the 585 work group to revise the assessments.
Any questions on the assessments? Senator Stewart.
Thank you, Madam Chair. I'm just, because I've been out of school for so long and my children are finished, Can you just explain a little bit to me about the different, I mean, in the weeds, the different kinds of assessments, because I really don't understand that.
Sure. I mean, when we all went to school, probably when I was a teacher, we used multiple choice, A, B, C, D type tests. They give limited information both to us. You know, you can go in and say, this is a distractor, this is this, but you have limited information in an ABCD type test. You can't really see whether the student understands the whole thing that the test is, that item is trying to assess, or if they just don't understand it at all, if they're just guessing. So there has been a great deal of innovation in assessments over the past 20 years that really dig into multiple parts, ask the students to write part of their answers, and then use some AI scoring for that, and really get into complexities so it gives really good pinpoint information for our teachers. They understand fractions, but they don't actually understand slope. They understand how the words are coming together, but they don't actually understand and comprehend well enough to write the answer. So it helps dissect where the student's learning is breaking down and gives much better information to our teachers who deserve that information and can intervene much more quickly and much more efficiently, and to our parents so they can come side by side and understand where our students really are missing the mark. And when we use these generic multiple choice tests from our time period, you're not getting that great data for our teachers. In post-pandemic, we need good data, and we need that kind of information to support our students.
Other questions? Senator Hushman.
Thank you, Madam Chair, and thank you, Superintendent. I apologize. I had to step out, and you may have already addressed this in the presentation, but just looking at slide 4 with the math tutoring through the vendor Zern, I'm curious how many vendors were evaluated for this particular focus of math tutoring, and if you could speak a little bit about why Zern in particular was selected as a vendor.
I have past experience with tutoring vendors in other states, so I recused myself completely from this process. So I'm going to ask Mr. Dickey, because he manages our procurement process, to answer that. I don't know if you have the specifics for that question, but.
Senator Hashmi, we will. I'll go right back to the office and come and determine that exact count of respondents on the. But it was several for that particular procurement.
Madam Chair, if we could just also address the qualifications of Zern and some of the metrics that were used when this particular vendor was selected.
Yep. We'd be happy to provide the evaluation rubric and the respondents to that, more than happy to. I do know that I was happy to see that Zern was awarded, because we are seeing significant impact both in Texas, Nebraska, Louisiana, and Tennessee recently released a report. So we are seeing positive impact, but we're happy to get the procurement process to you as soon as possible. All right, I think the third question was around the Office of School Quality, and I spoke with some of you last week, but I just want to reiterate for those of you who weren't there, we have done a lot of work around school quality. We have some school divisions who have been in MOU status, which is our lowest performing school divisions across the Commonwealth, for over 20 years. That's not okay for our students, and we've really had to look differently about how we support schools and really look differently about how we provide those services. I have background from my experience of working with turnaround schools in another state and had the opportunity to really move some of those schools, and we're really proud of the supports we were able to provide. There's also some national frameworks that really lean in, and they focus on academics, staffing, professional learning, and those wraparound support. So we really wanted to think about that differently. And so we looked at our office, we looked at the staffing, but we also looked at the finances. And if we looked at what our finances were happening with our Office of School Quality, they have returned $49 million of federal dollars over the past 5 years. So they haven't actually been taking dollars and moving them to children. And what we want to make sure is that we're spending the federal dollars and spending the federal dollars well. So you see in 2023, zero, because we have taken that $8 million and we're working to redesign the supports and really drive with national experts. So we've talked to Hunt Institute about creating a literacy network with their national experts for our schools that are struggling the most. We're looking at those wraparound supports and really driving resources, but making sure we spend those federal dollars first And if those federal dollars aren't enough, I promise I will come back and ask for an appropriation to add supports in. But right now we need to make sure we're spending those federal dollars and not returning $49 million.
Senator Obeshane has a question.
My colleagues up here understand that I'm an educational troublemaker, and the help that we're providing to school divisions that are, I guess they're called MOU school divisions.
They are called some of them are called MOU school divisions in Virginia, yes. Those are schools that we have created an MOU to provide support.
I'm deeply concerned about those divisions. What are you all doing differently that allows you to deploy those resources, and are you able to point to tangible, measurable results?
I've been here 9 months, so no. But what we need to do is look at what has not been working. And so we've sat down with all 5 of our MOU school division superintendents and their board chair and said, what frustrates you? What supports were you receiving? What do you need? And in all 5 of those meetings, literacy came to the top. We are working on literacy. We are focusing on literacy. We need more shoulder-to-shoulder support. So we've gone out to the national network and said, okay, what are you doing nationally to support schools that are struggling the most with literacy? And some of that feedback was the network. How do we network them together? How do we come alongside those reading specialists that they're bringing in and think about differently those students who need the most, who have the most barriers to literacy? So if I'm coming in hungry, I'm obviously not going to be focusing on learning to read. How do we remove those barriers? But how do we help those teachers really manage those classrooms, ensure that they're focusing on literacy, ensuring that they're developing the language and the supports that those students need, and bringing in those national experts who have been successful, networking those school divisions, which is something that has not happened before in Virginia. Sometimes we expect school divisions to only go out and do it themselves, but we need them to come together and share what's working for you. We just talked about all the great things happening in Newport News. They need to sit down side by side with other people and say, this is working. This is going well. How do we build that practice? And so building that network is our important next step to make sure that we are listening to our school divisions, that we are hearing their biggest needs, and that we're supporting them. The second piece that they've asked for is around staffing. And what we also know what tends to happen in our MOU schools is they get this revolving door of staffing. They come in ones and twos, and it's really hard, and they don't have the support. Usually, and we've talked to Petersburg specifically about bringing in a cohort of teachers and then supporting a cohort so they feel connected and collaborative together, and they're learning side by side with others. And so we're working with Petersburg to think about a grow your own cohort and a cohort support where we bring a university side by side and work to build cohorts of teachers together. So we're really breaking the box. We're thinking differently about the work and trying to make sure that we're using strategies that are evidence-based and have worked across the country, and then helping them share and build those practices to make sure we're reaching every single school division. Ms. Kang, you said you might wanted to ask about mental health, so I'm prepared to talk about high-level mental health if that's helpful. If you don't need that, I'm happy. I know you guys have a very busy schedule. Okay, great. I am actually really proud of our work in mental health. One of the things that we have heard from our school divisions are the challenges facing our students and our families in post-pandemic, and really thinking intentionally. So when we looked at the Department of Education, we had an office over here, or an office over here, an office over here, maybe talking about school nutrition, maybe talking about economic barriers, maybe talking about family engagement. And we really wanted to bring that together in a one-stop shop, whether it was for our school staff that were managing mental health issues, or whether it was a family, or whether it was just trying to put resources together in a way that makes sense. A lot of times at the Department of Education, we think about our departments. Schools don't think that way. They think about helping kiddos. So we wanted to make our office and the way we worked with mental health reflect the way our school divisions are organized. So we have reorganized those services to the Office of Behavioral Health and Wellness. And that office has 3 parts. It's behavior interventions and supports, and that could be anything from chronic absenteeism to our VTSS system, but things that will help to help students access instruction better, whether it's behaviors, whether it's attendance, things like that. In addition, all of our school nurses are together. That includes our drug use, our drug overuse, our opioid abatement. Those things come together because a lot of times when we're looking at attendance, there's all kinds of health needs that come along with that. And then third, we have our student services office, which we've moved into the Office of Behavioral Health and Wellness. This includes our military connected. We've heard very clearly that our military families need mental health and supports as well, and allows that connectivity to our school nurses and our mental health supports within that office. We have food insecurities. We have school nutrition. We have our intervention, family support. So all of that has come together under one office. And so we have used a little bit of our federal funds to start that and make sure we have a director of behavioral health to make sure we can support today and that we're prioritizing that support and those resources. We launched that in January, told our superintendents at their conference about that, have started developing resources and supports, and are working with each of our regional superintendent representatives to ask them what would be most helpful and what would be important for us to focus on. I also had the opportunity with Senator Hashmi on Sunday to talk to our elementary principals and our secondary principals on Monday about what they need in mental health and talk about what they want to see so that we can really shape this office to be responsive to the needs that our school divisions are receiving right now. But we need to sustain that office, sustain that director, and make sure we have a point person who's sitting at every committee and table thinking about our educators, thinking about what they need and what they need to support schools. And then I'm going to shout out Newport News again. Newport News has had a pilot mental health grant and really talks about how much that's provided support. We need to expand that. We need to make sure that we have more mental health grants that are comprehensive K-12 and can support our students and our adults in the mental health that they need. So the $30 million is about expanding those programs, making sure we're having a wider reach and that we're thinking intentionally about the whole school system. As we think about those school systems, we have rural communities. They may not have access to mental health professionals down the road. They may not have that resource and access, so we need to think differently about how we get that access. So the telehealth $14.4 million is the $7.2 per year over the next biennium that allows public school students grades 6 through 12 with parent and school permission to have telehealth services at home and at school to support their mental health needs. No matter where they are, no matter what access they have to resources, it allows some flexible support so those areas that we've heard from that don't have mental health staff can have access to that telehealth across the Commonwealth. So we're very excited that we have an office, we have a focus, that we're working with our school divisions to really intentionally organize our resources to support their needs, but we're also providing those grants and those opportunities to expand comprehensive support and then thinking about telehealth for those regions or areas that are really struggling to get staff to the students in a real way. So really proud of the mental health work, really proud that, we're one of the first DOEs in the country really launching an Office of Behavioral Health and knowing that we have to come alongside the academics with the barriers and supporting the barriers that are in front of our children.
And this is directly under DOE?
Yes, it is. So this office actually has a seat with some of the other agencies, but it allows us to actually represent the department. Yes, ma'am.
Questions? Senator Stewart.
Thank you, Madam Chair. Are these services to the 6-year-olds through 6 through 12 already underway? And
no, it's a budget appropriation.
So you want to do that?
Yes, yes. Wow. Thank you for asking.
Is that the most important area age group to focus on?
That's where we feel it's most developmentally appropriate to do a telehealth option. We want to make sure that we're providing supports. That's why the mental health grants for the $30 million is a K-12 system, but the telehealth is really focused on more of our middle school to high school where we feel like it's more developmentally appropriate to use this telehealth model.
Okay, thank you.
Mm-hmm.
Other questions? If not, we thank you, Superintendent.
Absolutely. Happy to be here.
Appreciate it.
Yep. Anytime you guys need, we're happy to come. Thank you.
All right, thank you. Well, that's all we have for our docket this afternoon. Thank you for coming.
Thank you. The Senate of Virginia, Richmond, Virginia.